Hi, this is Susie again, and I'm coming to you unscripted to talk about iron deficient anemia. So, if you've watched any of my other videos, you know that this has been several years of managing an illness that has so many variations, as people who have it know. Recently, I was starting to feel very, very tired. When you have chronic or severe chronic pain 24/7, tired is not new. But this was a different level of tired. I ended up having like 3 episodes in a 6 month period. And if you don't know what episodes are, please check out my episodes video. It's just my vernacular around what happens to me when everything goes to hell in a handbasket. Was at the hospital because I was at the hospital. They took my blood and it came back that I was iron deficient anemia and also that my white blood cell count was critically low and had a couple more blood tests over the past few months and it's showing the same thing. So I'm waiting for infusions. I'm sure some of you are not unfamiliar with infusions, but we're talking iron, nutrition, and white blood cells. But the reason I wanted to record this sort of impromptu is I can't even describe the level of weight in my bones and how just sitting takes every bit of effort I have. There's no room for anything else. And it makes you depressed. It makes you unmotivated. It makes you joyless. I have to tell myself this is temporary, this particular symptom, because I have an answer as soon as I can get into infusion. And then at least I'll have enough supplements in me and things to help me battle this lack of necessary systems like blood. So I felt really bad today. I could barely get off the couch. My daughter and granddaughter were coming over, and I haven't seen them for like a month because I have to be so very careful about being around people who are sick, as most of us do, but especially right now because I'm susceptible to any bacteria. And, I enjoyed it. They were here only for 20 minutes, but it always reminds me of the loss or what this disease has taken from me, and that I want to fight back. I I want to have healthy blood. I want to eat as much as I possibly can, given the circumstances. I want to enjoy my family, but with this leaded blanket on top of me, I do not enjoy anything. So, what are some of my strategies? Rest, stations for distraction. Even if you don't feel like it, visitors, sitting outside. But most importantly, as with all the suggestions, talk to your PCP about your additional symptoms. It seems to me like every time I have even the slightest something new, it means there's something else happening underneath that. So talk to your PCP, get the right lab works, and get a referral to hematology oncology if your blood comes back abnormal. That has to come from your PCP in most cases. Mine got stalled because it was my rheumatologist that caught it and he put in the order. And so, the whole insurance thing, you have to go through all the authorization and such. But every day I get lower and lower and lower. So I called on Thursday and then I called on Friday and I'm going to call on Monday because as soon as I get an injection, I'm going to feel a little bit better. And at this point in life, A little bit is better than nothing, and it will slow the progression. So like I said, this is a very impromptu video. A section will go in the book once I figure that out, but I was just feeling miserable today. And I know I'm not the only one. So if you have iron deficient anemia or low blood counts and you can relate to this, please leave me some comments on how you've dealt with it. I would appreciate it. Have a great day.